Hello, dear colleagues. This is Matteo Lambertini. I'm a medical oncologist and associate professor in medical oncology at the University of Genova, San Martino Hospital in Genova, Italy. I train in the same institution where I'm working right now. It's in Genova, in the northwest of Italy. During my 5 years oncology training, I had the chance to spend a few years abroad. First at the ESMO Jules with an ESMO clinical unit visit for a couple of months. Then I moved to the US, 6 months at the Dana-Farber Cancer Institute, working with Ann Partridge in the field of breast cancer in young women. Then Jefferson University, 3 months with Professor Cristofanilli, working in the liquid biopsy field. Then back to Italy to complete my training, and then I had the chance and the honor to get a ESMO fellowship for 2 years. So I moved back to the Institut Jules Bordet, where I had my PhD. So I extended to an extra year my stay in Brussels. So I got a bit more in depth into the field of breast cancer in young women, fertility, pregnancy related issues. And after my PhD, I got an academic position back at my home institution, and this is where I'm still working right now. On the first day of the ESMO Breast 2025 Congress, we had a very nice session on survivorship in patients with breast cancer. Very nice multidisciplinary session, also with the involvement and actually the organization by patient advocates. So we also had the patient view as part of the session. That was super important to set the scene on all the needs that patients have nowadays in the field of breast cancer. We have very effective treatment. We are able to cure the majority of our patients, and if we are not able to cure, we are extended way more the survival of patients. So the topic of survivorship in general is becoming a critical point in the care of patients with breast cancer. Very importantly, survivorship is not just quality of life, it's a more complex issue. There are at least 5 different domains that are of importance for survivorship. In this session, we mostly address 2 critical issues: physical effect of cancer, and particularly the toxicities of anti-cancer therapy. That was the focus of my talk, on premature ovarian insufficiency because of chemotherapy, as well as the side effects of endocrine therapy. The other important issue is sexual dysfunction. There was a special talk on this topic, and a more general concept of why it's important to measure quality of life, how we should do that, and how to use this data also from patient-reported outcomes in our daily clinical practice. Young women with breast cancer, the 3 topics we have mentioned are critical to be discussed: genetics, fertility preservation, short and long-term side effects of anti-cancer therapies. Over the past years, we have had a lot of news, I would say, in all these 3 fields. For example, genetics, it's very clear that age is an important consideration and criteria to refer patients for genetic testing. It's many years now we know that patients under the age of 40 should be definitely referred for a genetic testing in all the cases, irrespective of family history, tumor biology, or other factors. And having and knowing to be a BRCA carriers, we now know very well that has clear implication in prevention, so screening strategies, primary and secondary prevention, treatment, both local treatment, risk-reducing surgery, risk-reducing mastectomy, risk-reducing bilateral salpingo-oophorectomy, but also systemic treatment implication with the use of PARP inhibitors in the advanced setting, but also in those patients with high risk HER2 negative early breast cancer, and also specifically for young women, reproductive consideration, because having a BRCA pathogenic variant, it's critical to be discussed also during the oncofertility counseling, and could change the oncofertility counseling. Finally, the topic secondly, the topic of fertility preservation. A lot of data over the past years on the safety and efficacy of the available option, particularly oocyte embryo preservation, which is the standard of care, followed by the use of a GnRH agonist during chemotherapy. And on the other side, the safety of having a pregnancy after prior history of breast cancer. Also at this Congress, at the ESMO Breast 2025 Congress, we have had news also on how to counsel women on safety of pregnancy after breast cancer, particularly if they are diagnosed with breast cancer during pregnancy, which is something that we didn't have a lot of evidence before this event. The final point on toxicity management, again, a lot of important studies published over the past years, also randomized trials showing that there are different pharmacological and non-pharmacological options that can help our patient to better tolerate endocrine therapy, to be more adherent to endocrine therapy, and so to improve not only quality of life, but also to improve survival outcomes because they will be more adherent to treatment. There are many different important issues that should be considered in the care of breast cancer in young women. And for some of these crucial issues, we don't have a lot of information from clinical trials. Clear example, gonadotoxicity. So very critical information for the oncofertility counseling, discussing what's the risk of infertility, what's the risk of early menopause with the treatment. With most of the newer treatment options, PARP inhibitor, immunotherapy, CDK4/6 inhibitor, we don't have information from the clinical trials on what's the actual risk of developing these side effects with the use of this agent. So this is one example of data that we miss and we should collect as part of clinical trials. Others will be to have more data on safety, efficacy, specifically for young women with breast cancer. Also in terms of quality of life measure, patient-reported outcomes, with some special consideration for the young patient population. ESMO Breast 2025 has been a great event. I think one highlight talking about the topic of breast cancer in young women is that we have the Breast Cancer in Young Women event, so the BCY event, now part of the ESMO Breast 2025 Congress. We have 2 half days discussing the issues that are critical for the care of breast cancer in young women, with a final session and a sort of consensus where we are going to discuss 5 controversial issues. So what the experts think about these 5 controversial issues. So are we giving too much or not enough ovarian suppression? Should we avoid using anthracycline in some group of patients of young women with breast cancer? The topic of breast cancer diagnosis during pregnancy. The topic of data to be collected as part of clinical trial, and the critical issue of giving systemic or local estrogens in patients suffering from estrogen deprivation related side effects. In terms of other highlights, original data, I think we have had very important studies being presented in the supportive care survivorship field. Data from the positive trial, from the BRCA-BCY collaboration, reporting on fertility biomarkers and pregnancy after cancer. We did. We heard also about updates from important phase 3 trials. One example is the 11 follow-up years of the Affinity trial, so the study that brought pertuzumab in the adjuvant setting. So I think it's been a very successful congress, and it's been a real pleasure to be part of this event.